Hi, welcome to our latest Men's Health chat during Men's Health Week 2025. I'm Glenn Poole from the Australian Men's Health Forum, and joining us today is Brad Butt of Men's Health Down Under. Brad's a long-time friend of the Australian Men's Health Forum, but first-time webinar guest. Can't believe we haven't had him on before. There's not a lot about men's health that Brad doesn't know. He's dedicated his pharmacy career to men's health. He's the founder and lead pharmacist at Men's Health Down Under, which offers specialised urological services for men across Australia. He's based in Canberra and has been employing specialist men's health pharmacists there for a few years. And he's also got satellite services across New South Wales and offers teleconferencing and online services that cover the whole of Australia. He's got a particular interest in men's urological health. That's the stuff below the waist, fellas, and the medications and devices men can use to optimize outcomes. His areas of expertise include prostate cancer and prostate surgery, rehabilitation after surgery, erectile dysfunction, Peyronie's disease, and incontinence in men. And as a pharmacist, he's got a whole load of knowledge about a whole range of other stuff like medications for weight loss and is it safe to buy medication online? All these types of broader questions you can ask a pharmacist too. So that's all I'll say, except one thing I want to acknowledge the traditional owners of the land where you're all meeting from today. As usual, I'm joining you from the land of the Tarablang Bunda, the Grengareng, the Garang, and the Bailai peoples up here in central Queensland. And you're very welcome to share where you're coming from in Australia in the chat. Always good to hear where people are coming from. That's me, Brad. Over to you.
River, thanks, Glenn. Thanks for having us. And I'm on Ngunnawal country here in Canberra. Don't hold the Canberra part against me. I'm a pharmacist, as Glenn said in the introduction, and have been for half of my life, which is about 20 years. So that tells you roughly how old I am. I'm father of four. They're 11 and under, and in my spare time, I quite enjoy work. Clearly, so yeah, community pharmacist, no different to the one you get your scripts filled at. Each week or each month down the road from your local home or business. So that's actually my bread and butter, pharmacy. I was telling Glenn before we kicked off, I've recently had a few changes with our pharmacies. We've just sold one and we're buying another little one, and trying to set up interesting new services within those pharmacies. So you probably noticed over the last 5 years, 6, 7 years even, that there's been a fair bit of change in the pharmacy sector with pharmacists moving from just doing prescriptions to now doing vaccinations and leave certificates and medication reviews, and some of them now being going and undertaking further studies so that they can prescribe and look after minor ailments. Anyway, I digress. So yes, men's health pharmacist. I've been doing urological health, which, as Glenn said, is pertains to the stuff under the belt or under the kilt, as we often say. And I've been doing that since 2013, which is a bit of an interesting place to work. We had one of my regular patients at the pharmacy, Michael, his name was, a nice chap, diabetic. He was the sort of bloke who'd come to the pharmacy and tell the pharmacist a dirty joke. You'd have a bit of a laugh and hope nobody overheard, and he'd go. And there's probably people sitting on the call today a bit like that, you could think of that people like that. Anyway, Michael came in, he said, "Brad, I need a penis pump." And I said, "Yeah, right, no problem. That's never been asked that one before. That's quite funny. You just go to a sex shop and buy yourself a penis pump, Michael, and that's what you need." And he said, No. He said, no. Anyway, I said, "Oh, you're not joking?" And he said, "No." And I said, "What's going on?" He said, "I had a prostatectomy." And the early 20-year-old Brad, pharmacist with not much idea on life, said, "Sorry, mate, what's a prostatectomy?" He said, "It's where they cut your prostate out where you've got prostate cancer." Anyway, the next hour was an interesting conversation. We laughed a bit, we cried a bit, and I ended up having a session with one of the local urologists here in Canberra, and learned a lot more about what a prostatectomy was and what needs to happen after a guy has had a prostatectomy. So that was my introduction to men's health, really. I mean, obviously we had diabetics and high blood pressure and cholesterol and mental health and that sort of stuff coming through the pharmacy door. And that was good. That was great. It was lovely to be able to see those guys. But as we all know, generally, women in our lives tend to be the one who looks after health, particularly in the heterosexual relationship. normally the women come into the shop and it's nice, but we don't get a chance to talk to the blokes about how they're actually doing with their medications, which is a bit of a shame. So if you are on the call and you're a bloke and you get medications and a significant other is the one that goes to the pharmacy, every now and again, try and pop in and say g'day to the chemist, and so they can put a face to the name and they might be able to answer some questions for you. So back in 2013, we started doing support for guys who've had prostate cancer, and that largely was around how you manage the health of the penis after the operation. After a guy's had prostate cancer surgery, the penis tends to be a bit shorter, and certainly the erectile function is lost for a period, if not ongoing, or doesn't return properly for a lot of blokes, as well as incontinence issues. Now, both the incontinence and erectile dysfunction can be quite troubling. There's statistics that show incontinence in men, and this is urinary incontinence rather than fecal incontinence. Urinary incontinence affects about 1 in 8 Australian men, and it's actually the number one reason that they will withdraw from social activities is urinary incontinence. So for a bloke who's got urinary incontinence, he's worried about going out and getting his pants wet. He's worried about where he might have to put his incontinence pad. You know, is there going to be a bin there? Where's the nearest toilet? What if I get caught short? And that can be quite socially isolating. And we do know that social isolation for men and for women, in fact, is not great for their mental health. So blokes who are socially connected tend to do better in life generally with their health, be it physical and or mental. So this sort of stuff is really important, and we don't talk about it, right? Like, I think, you know, Australian Men's Health Forum have had somebody talking about cardiovascular health, I think they had, and one about prostate cancer. These are really important topics because they do affect so many of us. But we're probably a little better at talking about those things. Incontinence, urinary and fecal, erectile dysfunction. You know, these are pretty taboo, and particularly for blokes, you know, in that sort of baby boomer age range, that can be really hard for them to talk about. It's not encouraged, hasn't been encouraged, and they don't know where to start. They also say for urinary incontinence, and look, you know, you can broadly apply these stats to erectile dysfunction, but they'll be worse. For urinary incontinence, a bloke who suffers with urinary incontinence will sit and wait in a GP surgery, visit after visit after visit after visit, for up to, on average, 3 years before they say to the doctor, hey, listen, I've got some urinary incontinence. Can we ever talk about that? So that's 3 years, which is quite a chunk of time, particularly for something which is pretty manageable. And there's a lot of help available. And I think sometimes we fall into the trap of thinking, A, it's embarrassing, B, there's no help, and C, I can't fix it myself, so maybe nobody else can. And I've had a few public engagements over this Men's Health Week, which has been really lovely. And one of the things I keep coming back to is, if you're a farmer and you've got a tractor and a nice John Deere tractor, it costs you a lot of money, or you've got a car, we've all got cars, and engine light comes on in that car or that tractor, as a bloke, we're going to look at that engine light and say, something's not right. And we've got a couple of options. And I'm not particularly handy. I'm relatively practical. I'm off a farm, so I'm kind of practical. But it's probably beyond my scope to fix the car. But I'll try and tinker. I'll get the manual out. I'll have a look at it, see what the engine light means. Okay, it means that I can't fix it, and therefore I'm going to go to the mechanic. And I think all of us would do that as blokes, right? It's common sense. It's looking after your vehicle. We've invested a lot of money in buying the car, the tractor, the motorbike, whatever. So when we see an engine light, we're good. We do the right thing. We get it fixed up. And that car, that motorbike, that tractor, it's going to last us for many years, and we're going to sell it at some point and get our money, get some money back. So that all kind of makes sense. The problem I think for a lot of us blokes is when the engine light comes on in here or down there, and, you know, I'm talking urologically, if you've got some erectile dysfunction, that engine light coming on, and we'll use the example of erectile dysfunction, that engine light coming on where the erection isn't as good as it used to be, or it doesn't work, or it lets us down, or whatever, you know, whatever the problem is with it, that's actually telling us that something else is going on. Erectile dysfunction, and again, I'll try and get the statistic right, but forgive me if it's not quite right, but it's in the vicinity of 5 years we've got from the time we suffer erectile dysfunction to when we're going to have a heart attack, if it's of a cardiovascular nature. So if we've got some erectile dysfunction and then 5 years down the track we had a heart attack, we're getting that warning 5 years in advance that we could have some heart problems. So if for no other reason but to make sure that our heart's in good order, maybe it doesn't matter about the erections. Maybe it does, but maybe it doesn't. Even if it doesn't matter that the erections aren't as good as they used to be, we should be talking to the doctor about this stuff, or the pharmacist, or our friend, our partner, whoever, speak to somebody about it, and then let's do some investigation and find out why that might be. And it's a simple test, you know, it's a blood test. The doctor will say, okay, your erectile function's not what it should be. Thanks for letting us know. We're going to run some blood tests, have a look at your cholesterol. We're going to look at your thyroid levels. We're going to look at your testosterone. And testosterone's really topical. All the blokes want to use testosterone. They're talking about male menopause. This decline in testosterone as we age is normal. We've got to be really careful with testosterone. If we introduce it without the right checks and balances, it can cause problems. So super careful area. Super grey. The US are really pushing ahead with T therapy, which we're not sure about yet. We're going to let them make the mistakes and figure it out down the track. So, you know, is your testosterone low? Is the thyroid playing up? Is the blood pressure not right? Is the blood sugar not right? Is it of a mental origin? Like, is there some performance anxiety? Is there something going on there? But it can be an indication even of things like Parkinson's disease or motor neurons disease. So to get an erection, we need good blood flow, but we also need the message to get from here down to there clearly. And if the message on the wiring isn't working properly because of Parkinson's or something else that disrupts the message, a spinal cord injury is the perfect example. If we injure the spinal cord, you know, the message from the brain doesn't get to the penis properly, therefore we can't open the blood vessels to get the erection, and you know, we've got erectile dysfunction. So in a very long-winded way of saying it, if the engine light comes on in your body and you've got something that tells you it's not right, yeah, sure, sleep on it for a night, maybe two, but don't ignore it much longer than that. Maybe it goes away. And it's interesting, one of my good mates, I'm from Armidale in northern New South Wales. One of my good mates, hadn't spoken to him for 20 years. Part of this media release went out, and I got a call from a fellow called Heath, who's a good mate, and we were just talking about the engine light, and he said, well, my old man passed away last year, cardiovascular, and Brad, he'd had the warning light. The warning light had been on for a couple of years. There was different warning lights for him, but chest pain and shortness of breath, and he'd been ignoring it, and unfortunately he passed away, which is really sad. So ignoring the engine light because it turns off at some point is not a solution. So get that checked.
Brad,
Yes, Glenn.
can I just ask, while you're down there with erectile dysfunction,
Yes, mate.
what's the sort of the age profile for that? I mean, is it just something we should expect to happen because we're getting to a certain age, or is it something that can happen at any stage of life, or, you know, what's the sort of profile?
Yeah, great question. Look, I think probably the stereotypical picture, if I was to draw you a picture or display a picture on the screen of a bloke with erectile dysfunction, he's going to be overweight, over 50, and overworked probably. So that's so yeah, not pointing any fingers, Glenn, but
I'm ticking two boxes at least.
Yeah. So look, I think that's the stereotypical picture of a bloke with erectile dysfunction. But we know that bloke who's overweight, drinks too much, smokes too much, diabetic, high blood pressure, over 50, that may be a typical presentation, but there's so many that aren't typical. In Australia, at any one point in time, there's over 1 million blokes who are suffering with erectile dysfunction. The Australian male population, and you'd know better than me, but I suspect it's you know, over 50 might be about 6 million. So there's a lot of blokes who are suffering with this. We do get a lot of young blokes. So to go back a step, we've got clinics, like Glenn mentioned. There's about 30 sites around Australia, both within pharmacy and standalone, that do what I do, which is basically talking to blokes about how they can manage some of this stuff and talking to their doctor and neurologist and social psychosexual therapist and the likes. So we've got 30 sites around the country, and I think now more than ever we're seeing younger blokes. And it's interesting, I think, you know, pornography and social expectations around what's normal with intercourse is putting a lot of pressure on the blokes, and they're really not handling it well. I think mental health rates are getting worse, or poor mental health score is getting worse, and that's absolutely impacting on confidence. And with an impact on confidence, you get you know, erectile dysfunction. So I think, look, to answer your question, I would suggest that blokes who are over 50, overweight, and overworked are more likely to suffer with erectile dysfunction. But that's not categorically true. You know, we see plenty of blokes lean as a beanpole, and for the guys sitting here, or women as well, if you're listening in, there's plenty of blokes who are lean as a beanpole, pretty fit and healthy, and they have a heart attack, right? You hear about this occasionally. He's out riding his bike, going for a run, and had a cardiovascular accident, heart attack or a stroke, and sadly they can die from that stuff. And it's just that we may not have even had a warning light come on, right? We might have just not had a checkup with the doctor for 5 years because, I run 80 kilometers a week. I'm fit and healthy. I'd only get a skin check done occasionally because I've had melanoma, but I wouldn't know what my blood pressure runs at, and I should. And I would say that all of us should. We should at least have an annual checkup. No different to your car. You want to get that serviced regularly. So we should be checking our general health, and that'll discover this sort of stuff.
Mm.
I guess interestingly and probably related in many respects is the old PSA test, and which is an indicator for prostate cancer. And for those who joined earlier in the week and heard the prostate cancer talk, you're probably all over PSA. But basically, PSA is a blood marker, so you can take a little bit of blood, and it tells us how inflamed or enlarged the prostate is. And there's some reference ranges it should be between, and if it's outside the reference range, we could have some enlargement of the prostate, which could be possibly an indication of cancer. This sort of test is something that we should be doing regularly. Now, the government will only allow for it to be subsidised every second year. And there's a lot of GPs out there that will say, yeah, look, it's probably been all right. We can probably get away without doing it. Now, if you've got a family history of prostate cancer, and this is acknowledging that one in five Australian men are going to have some prostate cancer trouble down the track, about 25,000 diagnosed annually. So there's a lot. Most of us will know somebody who's had it. Most of us have got a little bit of family history, possibly. We want to make sure that blokes are getting their PSA checks done regularly. And it's not, we don't have to have the finger up the bum. It was an old misconception. That had to be done. That still can happen, but often it's a blood test that's done first, which is pretty painless, and we want to get it done annually. Obviously, if we pick up on this stuff earlier, and whether it's cardiovascular health, mental health, PSA, prostate health, the sooner we get a read on what's going on with this and what's wrong, the sooner we can address it and get a better outcome. And I think, this idea of the engine light on the car again,
Yeah.
The sooner we act on it, the better the outcome's going to be. And if it's prostate cancer, it's prostate cancer. If it's contained within the prostate, we have the surgery, and the 5-year survival after prostatectomy, where it looked like the cancer was contained within the prostate, is greater than 99% of the blokes who are diagnosed are going to live 5 years. So, I think we can go for it, Glenn.
Yeah, can I just ask you about that sort of that general test you mentioned? Because we get a lot of messages, particularly around Men's Health Week. Oh, men need to go and get checked, or men need to go to their doctors, and it's a good message on one hand, but then a lot of blokes are sitting there going, "Well, what do I get checked? I don't know what I'm supposed to check." So if you're just talking about a general check,
Yeah.
what are the key things that all of us should be thinking about checking from whatever our age, and can the pharmacist do it? Does a doctor do it? What is it? What is a general check? Can you just show up at your GP and say, "Give me a general check, please"?
Yeah, look, absolutely, you could. I mean, I think it's good to go to a GP or any allied healthcare practitioner, be it a pharmacist or a physio, with a bit of an idea as to what you want. I would suggest it's a very good idea in Australia, at least, to get a skin check done annually, and that the GP needs to do that. So most GPs are able to do it. Some can't or aren't comfortable. So you may need to go to somebody who can. So melanoma rates and BCC, SCCs, these are pretty frequent in the Australian population because we have a life where we live in the sun a lot. So a skin check is a good thing to get them to check. Our blood pressure, it's really easy. Quick check of the blood pressure, make sure it's in order. Don't forget with blood pressure, though, that it ebbs and flows throughout the day. And depending on stress levels, whether we've eaten, whether we've had a coffee, a tea, these things can make it change. So skin check, blood pressure. If you're over 50, prostate. If you're over 40 with a family history of prostate. You generally want to get a check on cholesterol and just a general blood screen. What's your iron up to? Red cells, white cells, is there anything weird going on there? How's your kidneys? And that would come up in a full blood count, they call it. So you're going to walk away from the GP with a referral for some pathology. So go and take some blood. You're going to have done a blood pressure, a skin check would be good. Look, that's probably the most critical bits, Glenn. I mean, if you're getting that done regularly, that's a good service.
Yeah. So one of the messages that we often have is just like know your numbers at any age, get a sense of those, and keep checking them, which is things like what you've mentioned, blood pressure, keeping an eye on body mass and
BMI or weight.
and weight.
Yeah.
cholesterol and blood sugar for the sort of the diabetes. So yeah, those are the four that are most commonly recommended. And then yeah, the skin. We've actually got a question around the skin check. Someone's saying they're booked in for a full skin check, but they don't know what it entails. What should they expect?
Well, I mean, they're gonna get you to go down to your underwear. Yeah, look, I mean, it's a skin check. They're going to check all your skin. They should check your scalp.
Mm.
We know that Glenn was myself were talking before, a bit thin on top. They're going to check that. So you expect them to check your scalp. They should absolutely check the part line, because if you've got a part, the sun hits that regularly. We don't wear a hat, and that's where you're going to have a problem. They're going to check your arms. They're going to check your legs. Back of hands are really common for guys, because when we're
Yeah.
driving, the sun burns our hands. We end up with sun damage. Our foreheads, our face. They'll check between your toes, between your fingers. They'll check up in your groin. I've had a
Mm.
melanoma taken out from where the sun doesn't shine. So just because the sun doesn't see it doesn't mean you can't get a spot.
Yeah.
And what they're looking for is they're going to look at the family of moles and spots you've got. So I look at my skin. I'm fairly fair complexion, not a lot of moles, but they're going to
Mm.
say that looks normal, and it looks
Mhm.
like the rest of your moles and freckles and the likes, but that one doesn't, for different reasons. So they're pretty good at discovering it, and they often use a dermatoscope where they can put it up to their eye and have a look. It's got a bright light. It helps see whether the margins are solid or fuzzy. But be prepared to get down, take your shoes and socks off and your clothes off. You're going to get a full skin check, and that's what we have to do to make sure that there's nothing lurking where we wouldn't normally think that it was.
Great, thanks for that question. I've got a couple more questions come through if we want to
Fire away.
pick those up. Right. So we were talking about PSA and the different ages when we should start to ask for them. So I've got a question here. Someone says, I've been told that the PSA test can have false positives, and it says if you've had sex or had a decent bike ride in the
Yeah.
previous 2 weeks, can't fully remember the time frame. Is there any truth in that?
Yeah, absolutely there is. So anything that puts a bit of work on the prostate can cause the PSA level to go up. PSA is just an indication of inflammation of the prostate. It doesn't indicate cancer, not at all. And I think sometimes we get confused by that. So there's blokes that'll be out there with relatively high PSAs that are functioning quite fine. It just means they've got what they call BPH, which is benign prostatic hyperplasia. And
Mm,
the frequency of that is the same as your age. So if you're 50, 50% chance. If you're 70, 70% chance. If you're 83, 83% chance of having inflammation in the prostate. So in terms of this false positive, it could be age related, i.e. it doesn't necessarily indicate cancer, just inflammation of, and they might put you on medication because you've got some symptoms of, they call it LUTs, or lower urinary tract symptoms,
mm,
difficulty starting urination, stopping urination, weak flow, poor erections, and the medication can help with that. But the question around the false positives, perhaps in light of going for a bike ride or having intercourse, and there's some medications too that I might just add, Glenn, can affect the PSA.
mm,
So if you're starting or stopping them around the time that you have the blood test, yeah, you can absolutely throw a false reading, and it would be pertinent to either abstain from having sex or bike riding for a couple of days prior, or if often the GPs are switched onto this stuff. If one comes back a bit funny, they'll say, "Oh, look, go and do it again." You can even get variability, Glenn, for what it's worth, between
mm.
pathology providers. So if you always go to
Yeah.
Lavity, go to Lavity. If you always go to a different one, if you chop and change because it's convenient with work or
Mm.
home or whatever, you can get some slight variation. So it's really important that you try and go to the same place for that. And I would say that's true for your general practitioner, your
Yeah.
pharmacist. You try and maintain a health record at the one place so that there's um, continuity. I think that's really important, and we forget to do that sometimes.
Yeah. While you're on that, actually, we were just chatting before we came on about sort of the opposite of maintaining that local personal connection and the growth of online pharmacy or online drug sales, particularly sort of I'm not going to name any, but particularly
No, no.
that are actually specifically directed at men. And I think to some extent, quite a few men like the anonymity of that. But is it safe? Is it a wise thing to be shopping online from these online providers?
Oh, look, Glenn, it's a real concern, I think, for governments around the world. This is it's pretty commonplace, and mate, in your home country, in the UK, mate, the proliferation of these online fly-by-nighters is really quite concerning. It's not so much, well, I mean, it's as much the credentials of the doctors perhaps as it is the counterfeit nature of some of the drugs that are supplied. So you're really not sure what you're getting. They might prescribe a treatment for erectile dysfunction or hair loss for you, but what you get could be some counterfeit medication from God knows where, and it could have who'd know what in it. So these sorts of programs aren't good. They fragment the healthcare system. And I mean, if you listen to the news and watch what's going on in the healthcare sector, there's a lot of talk about fragmentation of healthcare and how dangerous it can be, both because your GP, who really should be looking after you as a whole globally, isn't getting the information they need, and it's not accessible in the My Health record. But more than that, a lot of them are quite tick and flick by nature. And I think that anonymity is a lovely thing, but we can still have anonymity and get good quality healthcare without necessarily going to one of these online providers where you sit on your computer, you click 5 boxes that ask about, your family history of prostate, your blood pressure, your sugar, and how active you are. And then all of a sudden it says, yeah, you qualify for some Viagra. Would you like to pay $80? We'll deliver it to you next week. And then every 12 weeks after. So I think that and I think it's, we were talking about the capitalistic nature before, I think if there's money to be made, people will do it. But these sorts of questions are best taken absolutely to your GP. But I mean, and look, as a pharmacist, and I've tried not to talk too much about, or tried not to push pharmacy too much, but I think pharmacy is a fantastic channel to take this stuff to. So many pharmacies now have got private consultation spaces, and the pharmacists are more knowledgeable than ever, and certainly well connected within the community. So if I said, oh, listen, I've got some erectile issues, or my urine doesn't come out real strong, or I'm getting up 5 times at night to go to the toilet, I would absolutely be comfortable to ask that question of my local pharmacist, and know that the pharmacist, not only do they know what I'm talking about and they hear it all the time, but also that they then know who to refer you to. Maybe you don't have a regular GP, and we see this in our clinics a lot. The boys come in to see us, and because they don't know where else to go for all of these issues under the belt. And as a pharmacist, I can't prescribe anything for them, but I'll tell you what, I know exactly where to send them here locally in Canberra, as do the entirety of our network, so that they can get the help they need. And sometimes if they're in regional and remote areas, which presumably some of the boys on this or watching this afterwards will be, healthcare can be really hard to access. Maybe the doctor doesn't have, maybe they mumble, maybe their English is not great, maybe they only come once every second week of the month. So there's a lot of reasons getting to maybe they've only got, limited appointment availability and they can't see when you need to see them. So the local pharmacy often is a really good place to go and get healthcare advice, certainly in the interim. And then the pharmacist can pick up the phone to the receptionist and say, hey, listen, I know it's a 3-week wait for Glenn to see his regular GP, but can you get him in to see the other GP to get this issue resolved? And that pharmacist phone call can actually skip the queue a bit, if that makes sense, so that we can get the solution. So I think online serves a purpose, but it's set up to deliver profit to the people at the top of the tree, and it doesn't necessarily always bring about a good health outcome. And I'd be brave enough to say, I reckon that sometimes it's actually a Band-Aid measure where there's a festering wound, they put a Band-Aid over it, prescribe the pills, and then 2 years down the track we find out actually we should have done more about that.
I was just thinking exactly in the Viagra situation. It's like, I can't get it up. I've heard about the blue pills. That's what I need to fix it. I'll go and get some of those online. Maybe it fixes it temporarily, but you're not getting the whole sort of check of all the others. You're not using it as a warning light.
No. Well, you are, but you're not. But
yes.
It's like hitting the warning light on the dashboard of your car with a hammer so that it turns the light out. It's actually not fixing the underlying problem. Correct.
Yeah, you've decided what the problem and the solution is without actually getting a proper diagnostic. You haven't run the full diagnostic on the warning light, then basically.
That's right. And that warning light's not going to turn back on again for quite some time, because you've found something that turns it off. And in the case of smashing the dashboard, it ain't turning back on until you fix the dashboard now. So yeah, I think we're to be really careful with this stuff. I guess again, now I am going to plug pharmacy. The pharmacies now have got a lot of they call it point of care diagnostics that they can run. A lot of pharmacists would do it for free, and if it's not free, it'd be a fairly minimal cost. And I'm talking, get a blood pressure check done. You can get cholesterol checked. And the cholesterol checks used to be, you had to fast before them, and they were quite strict. The new ones that have come out, which a lot of pharmacies are taking on, they don't require fasting. They give full breakdown of the cholesterol picture, HDL, LDL, total cholesterol, triglycerides, the whole works. They can do blood sugars. They can do HbA1c. HbA1c is an average blood sugar for 3 months, which is really insightful, because we can prick your finger now, Glenn, and have a look what it is. But if you've had a piece of toast with with some jam on it 2 hours ago, your sugar may still be a little higher than it should be. But an average over 3 months is going to tell us what it's running at. There's even really cool stuff going on now with blood checks, like little spot blood checks with PSA. So we're seeing these overseas, and it's only a matter of time until we see them in Australia, I suspect, where you can prick your finger, put a dab of blood on the little thing like a COVID test, and it'll be able to give you an idea as to what your PSA is up to. So there's some really cool stuff happening both in pharmacy and not so far away. And I think that relationship with the pharmacist and being able to ask some questions because they're so accessible, it's a really nice relationship to have.
Yeah, and you've still got that ability to walk in and hopefully get seen rather than having to, book ahead for an appointment in 2 weeks' time.
Yeah, and I mean, often, and I think we saw it in the election recently. They're going to throw many billions of dollars at general practice to try and ensure that everybody can be bulk billed for their appointments. And I mean, the sad reality of that is that I think that it's probably not going to get to where it needs to get to, which is often the case with some of this government money. And I suspect that in 5 years' time, we're still not going to be paying a copay with our GP, which I'm not adverse to. I think that that's okay. I think if we give things away for free all the time, we cease to value them, and then we end up with people with a runny nose at the GP, where they should actually just come into the pharmacy, get some cold and flu tablets and a thing of hand sanitizer, and allow themselves to get better. But that aside, I think that the pharmacy is a good place to go, where it doesn't cost you anything to have a chat to a trained medical professional or healthcare professional. So you can pop in, you might have 5 or 10 minutes with the pharmacist and not have to put your hand in your pocket for anything, which is something that's really fortunate. And I'm ever hopeful that it'll continue in that fashion, because it's such a nice way to be for us as a pharmacist to not have to charge somebody for our time, as opposed to lawyers and doctors and dentists and accountants and everywhere else you go. You seem to put your hand in your pocket and be paying them per minute for their time, where that, you can get away with that in pharmacy and not have to charge, which is lovely.
Yeah. So that's great, Brad. We've got another question, slightly different direction. And this sort of also links to one of the issues that we often see, people selling solutions to online directly to men. The question is, can you please talk about premature ejaculation and how to extend time with a partner?
Yeah, great. Good question. There's what they call the orgasm gap, and it's widely regarded as being the truth. And basically, this orgasm gap is that men will typically climax a good 2 or 3 minutes quicker than their female partner, and I'm talking in a very heterosexual nature in this sense. So the orgasm gap is well known, it's well written about, and there's a lot of blokes that feel worried about it, frankly, because I think intimacy is something that we all take for granted until we can't. I think for the blokes who do suffer with premature ejaculation, and I'll be clear here, there's a clinical definition for premature ejaculation, and it's something like 30 seconds, or it's a very short period of time. But then there's a non-clinical definition, which basically is not lasting as long as they'd like to. And I guess this is where it gets grey, right? Because you watch a bit of porn and you think, oh gee, that fella lasted for 20 minutes. Everyone should last for 20 minutes. Well, that's not the reality. Everybody doesn't last for 20 minutes. And to last for 20 minutes, she's probably going to be sick and tired of it generally. So, maybe you don't want to last that long. So I guess, there's a very clinical definition, but then there's the orgasm gap, which basically says, I'd like to last another 2 or 3 minutes so that I could climax at the same time as my partner, or at least get them to climax as well, because caring is sharing. And I think as blokes, we all want to make sure that our partners are enjoying intimate time as well. And there's a lot of fly-by-night sort of stuff with premature ejaculation and really expensive treatments that don't have a lot of basis to them. So And I think it's something we're going to grapple with for many years to come. I'm not sure how we naturally close the orgasm gap, but there are things that you can do. So, and not to get into too much of a clinical conversation, but you can absolutely get medication. So there's things like Prilogy you can get from the doctor. It works a bit like an antidepressant, actually. In fact, I think it was developed as an antidepressant, but they found that one of the side effects of the medication was that it caused guys the inability to climax at all. So they said, oh, maybe at a little dose, it'll help delay ejaculation, and lo and behold, it does. It's relatively expensive. It comes in small pack sizes, and I would suggest is not everybody's cup of tea. There are other variants of antidepressants, like you can get low dose Arapax or paroxetine, sertraline, venlafaxine. So a lot of these antidepressant style medications will have that side effect if you read through the screed of information the chemist gives you, through to even erectile dysfunction. But we can use little doses of them. They tend to work pretty well, but it's not perhaps something you want to take on a really regular basis. Then you've got other medications you can take, and they use tramadol, which is a pain medication, and dextromethorphan, which is a cough medicine, at very low doses. They tend to work pretty well as well, but some GPs would be of the belief that they're perhaps a little addictive in their nature, particularly tramadol. You wouldn't want to be taking that every second day to delay ejaculation, but they're not bad options for blokes who have tried the antidepressant style medications and found them either ineffective or too many side effects. And then you've got some of the, and this is my little one that I really enjoy. As a pharmacist, I should enjoy the drugs, but I actually love the medical devices, and there's some really cool stuff out there. And just to plug Men's Health Down Under, you can go to the Men's Health Down Under website, and there's a bunch of stuff on there under premature ejaculation. There's a lignocaine spray, which is developed by a bloke here in Canberra, an anaesthetist. That's a medicine. But the lignocaine sprayed on the frenulum, on the underside of the penis, delays ejaculation by reducing sensitivity. But a lot of those sprays, the numbing sprays, numb the whole penis, because once the stuff goes on the skin, it gets in the blood and is distributed through the penis really quite quickly, and you end up with a numb penis, which is not an enjoyable experience. So Steady Freddy is a good one. And it just numbs the frenulum, which is on the underside of the penis where the glans attaches to the shaft. That frenulum's that little bit of little flap of skin. The other things which you'll find on the website, which I think are more medical devices and quite useful, are based around cognitive behavioral therapy. So this is teaching our brain to not climax as quickly. And there's a product called MyHixel, which is a gamified male masturbator. And you teach yourself to delay ejaculation, which I think is quite a beneficial way to do it. A lot of blokes have done that successfully, and that does absolutely help to close the orgasm gap. You can get other products, which, like some of the restriction rings that are on there, which will trap the blood in the penis, keep it erect, and prevent the ejaculation from coming out. So, we talk about visible, clearly you've ejaculated, the ejaculates come out, but we can use restriction rings to both keep the penis erect after we've climaxed and to block the flow of ejaculates, so that realistically whoever we're having intercourse with would have no idea that we had climaxed. So these things could be quite useful as well. Look, none of them are perfect. There's no holy grail to this. It could be a combination of solutions, and I would suggest that a two-pronged approach with cognitive behavioral therapy and or medical device with a pharmaceutical is probably not a bad way to go. But it's very patient specific, and it depends on what they're hoping to achieve. Like, we've got guys who will do penile injections so that the penis remains rigid after climax, because they want to make sure that they're satisfying their partner. And that's fine too. I think it's just all got to be checked and balanced by a pharmacist in the interim's fine, but probably a doctor once we get to the point where we're injecting medications.
Mm-hmm. Great. Well, thanks for that thorough answer. Lots of great tips there. And thank you for the for the question. I've got one more here, which this is about SSRIs.
Yeah.
Someone in their 30s. It said, what are the recommendations for someone like me in my 30s for SSRIs, like sertraline, it says? Mostly I've had a little nausea and not noticed too much change in sexual drive, performance, etc., but I'm early in treatment.
Yeah, look, good question. I think as a pharmacist, if I put my pharmacist hat on as opposed to the men's health hat, when talking to guys about initiating on an SSRI, an anti-anxiolytic or antidepressant, however you might like to refer to it, it's absolutely something that I'd point out to them, not to frighten them, but just to make them aware, so that if they do notice any changes, they're at least prepared for it, and they're then comfortable to come back and say, hey, Brad, I hate to tell you, but mate, I'm having, you know how you said I might have delayed ejaculation, inability to ejaculate, or erectile dysfunction. I'm actually having trouble with it. What do I do? Because a lot of the time when the GPs, unfortunately, unfortunately, the GPs are typically prescribed these medications, and the GPs are really time poor. Like, time is of the essence for these GPs, so they might not have a lot of time to discuss the full range of side effects. And there's a lot of stuff that's been reported on these. Over the years, they compile a list of side effects that are reported, and that's what you see in the information you get from the pharmacy, or if you go online and have a look, that's the accumulation of that is what you see. So I guess in answer to the question, early on in treatment, not having too many problems at this point, I'd say you're probably off the hook, which is great news. So it's probably not something that's going to bother you now. What I would say, though, is that they'll often start you in sertraline, as an example, they'll start you on maybe half of a 50 milligram tablet, so 25 milligram. They might do that, and this would be conservative, they might do that for a couple of weeks. If you're tolerating it okay, and by tolerating it, I mean it's not making you feel nauseous, keeping you awake at night, affecting your mental alertness too much, then they'll probably bump you up to 50 milligrams, and you probably be on that for 4 to 6 weeks. And then the benefits from an anti-anxiolytic and antidepressant point of view kick in, at which point they say, how are you feeling? And you say, still not a lot better. And they might increase the dose up to 100 milligrams. And hopefully that does the job. Obviously, as they're increasing the dose, the incidence of these side effects around erectile dysfunction and premature ejaculation are going to become more prevalent. We're going to see more of it. So the little bit of nausea, super normal. I wouldn't be stressed about that. That could last 4 to 6 weeks, but it shouldn't last longer than that. If it's been more than 4 to 6 weeks and you're still feeling nauseous, then yeah, absolutely, engine lights on, flashing, have a chat to the doctor about that. But if you've missed out on the delayed ejaculation and erectile dysfunction, I think that's a good place to be at this point. That shouldn't bother you down the track unless you have a big dose adjustment.
Right. I think we've got one last question, and it's a friend of mine. So a friend of mine says his weight goes up and down quite a bit, Brad. Despite how much, no matter how much he tries to exercise. What are these? What do you think about all these new weight loss drugs that are out there? Is it an easier option rather than struggling with trying to keep our weight down? Is it good?
Yeah, look, aren't they wonderful? I mean, these things have taken the world by storm. You've got companies like Lilly in the Netherlands. That's the company's making more. That company makes more money than the total GDP of the whole country. So these drug companies are absolutely cashing in. They are making a lot of money, and their product. Look, I mean, the science is there. I think the conservative part of me says, I think we sit tight and we just let somebody else stuff it up first and see what problems they cause. But look, I think for face value at this point in time, they're causing very few problems. Yeah, they can cause some nausea. They're causing a bit of pancreatitis. There was talk about them causing thyroid cancer and some of these other sorts of things. It's a real fine balance. And I think if you dig deep enough on this stuff and get into some of the conspiracy theory stuff, you're going to find stuff that's going to put you off taking it. My thoughts at this point is that they're safe, they're effective, certainly, there's no doubt about that, and they're doing a really good job. And, you know, a bit like, and you know, this is a women's health one, a bit like hormone replacement therapy. If the girls are going on hormone replacement therapy, we know that it can increase their risk of breast cancer, but we also know that it reduces their risk of endometrial cancer. So again, with the weight loss things, you know, does it reduce our risk of having a heart attack, having a stroke, buggering our joints because we're carrying so much weight that we end up with arthritis? Yeah. Does it make us feel better about ourselves because, you know, they say look good, feel great. So maybe we're carrying, you know, a few kilos more than we'd like to. You know, we want to feel better in our own skin. You know, so I think dropping the weight, you know, has many benefits beyond the scale showing that you're 20 kilos lighter. Now, I guess the pharmacist and the holistic person in me that goes out running 5 mornings a week says, yeah, it's okay to use the medication, but you should do it with a balanced diet and exercise. And what we do know, and I put on another hat, I do a lot of work with bariatric surgeons. So bariatric surgeons do all sorts of surgeries to cut the tummy and the likes, which will help with weight loss. What we do know in those practices is you'll often be told you need to talk to a psychologist, because a lot of this weight stuff can be related to the psychology of eating. But equally, we don't want people having to take these injectable medications forever thereafter at low dose to maintain the weight loss. We actually want them to be on it for 6 months, drop the 20 kilos or whatever it might be, and then be in the position where, okay, now that I've dropped the weight, I can exercise more. I'm making a concerted effort to eat more healthy food, restrict alcohol. Often it's a lifestyle change that comes with it. So I think, this idea of the drug being the panacea and the solution to a problem is a great one, but I'm not sure that we can look at it in isolation. I think it's got to be part of a full health overview. And if you do that, they are fantastic